So welcome back to our 6th video in our series, and today we're going to be talking about adult choking. In the coming weeks we're going to talk about infant and child choking, and we have a separate series coming on that. So last year in Ireland in 2020 there was figures on that came out. There was 100, 120 or 150 deaths per year. Which one do you think it was? Take your time. If you said 120, you're correct. I read an article on the journal.ie there lately, and it stated that there were 17 calls per day to National Ambulance Service for choking patients. So what are we going to do for a choking patient? It's very simple. So watch our scenario next. Okay, so here we have a patient. So what we're looking at is the universal sign of choking. So this is normal standard stuff that you'll see in a restaurant or a film or whatever, or if you come across it in a home environment. So I'm going to ask the patient, are you choking? Patient nods, but he's not saying anything. So obviously he's choking. So the first thing I'm going to do is turn him around. There's different methods here. So the first thing I'm going to do is lean the patient forward and give 5 back slaps. 1, 2, 3, 4, 5. That doesn't work. I'm going to turn the patient around just for the purpose of learning here. So another thing too, when we're dealing with a patient, we must be able to stand here and stand in this kind of a position, and the reason being is I can hold my patient up no problem. If you were dealing with somebody of my size and I'm 20 plus stone, I wouldn't expect you to hold me up. The reason being that my leg goes in here is that if the patient falls backwards like this, I can hold the patient. I can't be knocked off. Another thing we're looking is abdominal thrust. So there's a few different ways of doing it, but the first thing we're going to do is locate our belly button here. We're going to locate it, we're going to close our fist, keep our hands nice and flat, and we're going to pull in and we're going to pull upwards like that. And we're just slightly a bit above the belly button here. The reason being we're not going up here to the tighter part of the chest where you'll see some people doing it is because we have the xiphoid process there, and there's a piece of cartilage and we don't need to break that. And what we're hoping to do here is push in and push up along and hopefully push air up to get that foreign body out. So the next thing, I'm going to stand in here, I'm going to locate, and I'm going to go in and upwards. Now suddenly then, as a result of that, if the patient is still choking, remember we talked about the muscles here, they're very tight, can be very strong, and they'll hold the foreign object. So what's happening here for the purpose of health and safety, I'm going to just get my patient to lie down on the ground. So what's going to happen here is I'm going to start chest compressions. It's a witness collapse. I'm going to call an ambulance straight away, and I'm going to start chest compressions. 1, 2, 3, 28, 29, 30. I'm going to open the airway, look in the mouth. I see an object. When I see it, I can go after it. Next thing, I take it out, throw it out, patient is coughing. Just relax there for a few minutes now, just relax yourself, and we're going to get an ambulance on the way for you shortly, okay? We're dealing with a patient if we can't get our arms around the belly, because I have a slightly large belly myself. What we can do if we're dealing with a pregnant patient or somebody that, as I said, you can't get your arms around, we can come in behind the patient, get them to lift their arms, make sure your stance is good as well. You're going to put your hands in and you're going to squeeze their chest this way. So if you remember as a child playing and you got a bang to the chest, the first thing that happened is you'll move air up, and hopefully that foreign object will come out. So when we're moving on to choking, you're at home, you're on your own, there's no one around, you can't phone an ambulance because what happens, you're starting to choke. So what can you do? You can find a chair or some object like this, and what happens is then you can actually leave yourself onto it or throw yourself onto it. I've met a good few cases over the years where I've met patients who have done this themselves. I met one fellow who went up 4 steps on these stairs, jumped onto the newel post at the end of it, cracked the rib, but at the end of the day he's alive, as discussed a few minutes ago. How long can you hold your breath? So even if you're dealing with a large patient and you can't get your arms around them like we did there a few minutes ago, what happens in some cases, this is very good. What you need to be doing then is aiming for this part of your belly here to hit the corner of the object. Now it may look very sore, and it can be sore, but the thing behind it is you need to be looking after yourself. So in our body we have 2 pipes. We have one at the front and we have one at the back, and this is our trachea and this is our esophagus, and our esophagus is where our food goes down and our trachea is where air goes down. So normally around your trachea here, what happens is a C-shaped cartilage, and it actually slides on itself slightly like that to allow for movement. And the reason being is because the esophagus sits behind it. So normally when you eat a bit of food, there's a flap that comes across here called your epiglottis, and it blocks it off so that it allows the food to go down. Now they're very sensitive muscles around here, and it's happened to us all at some stage. We've drank a drop of water, we went down and we have to start coughing. So when we start coughing here, these muscles contract and you get that choking like feeling. Another thing that happens a lot of people as well, and it happens to myself quite regularly, because I'm not chewing my food properly, when you go along and you eat, what happens, a hard bolus of food goes in and can actually kind of push in on your trachea as it moves down along. And you can feel it moving down along your trachea, but really and truly it's in your esophagus and it's moving. So what happens, a lot of people, they get a kind of a partial obstruction. So tonight, quick recap, we talked about choking. So the first thing we did is we asked the patient, are you choking? The universal sign of choking is this. Remember, if they say, yes, I am choking, it's probably a partial airway obstruction. You're going to get them sit down, you're going to seek expert help, i.e. call an ambulance. Next thing we're going to do, if it does move across and we have a full choking, we're going to go along and we're going to start 5 back slaps. So I should remember that. Another thing we're going to do is abdominal thrust. We're going to locate the belly button slightly above it, put our fist here, put your hand in, and you're going to pull it in and upwards. If the patient collapses, remember, call for help. Next thing, we're going on the ground and we're going to start off with 30 chest compressions. Remember again, we're 2 bags of air here, and as I press down along, what happens is the air is going to move up. As I also discussed, remember we talked about the muscles. When you become unconscious on the ground, your muscles hopefully relax and that you can actually move it up along. Keep tuned for next week's video, and we're dealing with the unconscious patient. And if you like our videos, please like and subscribe. Thank you.